everyone, I want to welcome you here today to the first video series I'm creating for postpartum women who are in that 6-week ready to start exercising again phase of life, and they don't know exactly where to begin. So I want to help you guys start on some gentle movement, some core strengthening, reconnecting to your body. And so we're going to do that today with these exercises. I am a pelvic floor physical therapist who specializes in women's health. And so I have found that there are not enough resources out there for women, especially when trying to recover after having a child. So let's get into it today. Just do what feels right, what feels good to you. If you need to take breaks, do so. But we are going to start with lying on our yoga mat or wherever's comfortable and begin with some breathing. So we're going to start laying on our back. Find a comfortable place, knees bent, and we're going to start to connect to our core, which is made up of our diaphragm, our abs, our pelvic floor, and our spinal stabilizers. And so with our breathing, this is how we're going to start. You can put your hands on your belly, and as you take a deep breath in through your nose, you're going to inhale. Feel that belly rise, everything expands, your pelvic floor lengthens, and then on the exhale, gently sighing out through the mouth, everything comes back in together, and there's a little lift in your pelvic floor. So let's do 5 of those together. Inhale. Exhale. And as we begin, we're going to try to lengthen our breath, really get that expansion. Exhale, feel that lifting in the pelvic floor. Everything's coming in. Inhale, expand. Exhale, abs are coming in, pelvic floor is lifting. One more. Great work. So now we're going to move into our pelvic tilts. We're going to keep it going with the breath. So as you inhale, you're going to slightly arch your back. So if I inhale, my hip points are rolling towards my heels. There's a slight arch in my back. As I exhale, I'm rolling the hip points up towards my ribs. My tail's kind of tucking under, and I am getting all the muscles of my pelvis, my pelvic floor, my abs, all working together. We're coordinating it with our breath. Most women I see postpartum, we've got this rib flare going on. Everything's been expanded. You know, the baby was taking up space, and so now we've got to cinch those ribs back down. So as we inhale, arch, everything expands. Exhale, round, everything tucks, the belly draws in. Inhale. Exhale. Now move at your own pace. Don't feel like you have to keep up with me. Find your own rhythm. Find what feels comfortable. So if it just means these little pelvic tilts, that's great. If it feels good to really get a stretch through your spine, rounding through the hips, do that too. All right, great work. So now we're going to move into core brace with a march. So in order to brace our core, we're going to incorporate that breathing technique. So you're going to inhale, expand the belly. Exhale, draw the belly in. And now we've created a nice, tight, supported pelvis. keeping that tension in the abs, you're going to march your foot up and we're going to alternate. And the purpose of this, it should not feel super easy actually. It should be a challenge because you're trying to keep everything as steady as possible. So we're keeping those lower abs drawn in, we're breathing, not holding our breath, and we're trying to keep our pelvis and our back steady as we alternate lifting our legs. So basically, if we're losing control, then there's like a lot of rocking through the pelvis that would happen, a lot of foot plopping. So we don't want that. We want nice and controlled movement. The abs are engaged. We exhale to lift, inhale to lower. Good, a few more. Last one, or even it out. Great work. Now we're going to move into a bridge, so to start to strengthen our glutes. We're always timing things with breathing and engaging our core, waking those muscles back up. So we're going to make sure we exhale, draw the belly in, raise the hips. It could be a small lift, it could be a large lift, just see what feels comfortable. Inhale to lower and let everything relax. Exhale, lift, draw belly in. Inhale, lower, let everything lengthen. I am being mindful that I'm keeping my knees in line with my hips. So I'm not letting my knees cave in towards each other. I'm not letting my knees flare out as I press up. I'm trying to keep everything nice and in the sagittal plane, nice and square. Even lift through both sides. I'm feeling even pressure through both feet, not favoring one side or the other. Inhale to lower. Exhale to lift. Okay, now we're going to roll into our sides. Just getting back to getting a good position here. We're going to start to work more of our glutes, our gluteus medius. It's a great stabilizer muscle to give us support as we walk and move. So we want to feel the muscle right here working in our hip. So we're going to be on our side with the knees bent, feet together. It's called a clamshell. You can have a head pillow. Keep your neck comfortable if that feels good. But feet stay together, and then that top knee, we're gonna lift up, rotating through the hip, and we wanna feel that burn right there. So as we lift the knee, we exhale and draw the abs in. Inhale to lower, exhale to lift. Now you don't need much height to get a good workout of that muscle. What some people do to get more height is we start to roll back. Now we're losing our core stability and we're not really targeting that muscle. We're just using gravity and momentum to lift the leg. So we want to exhale, lift, inhale, lower, nice and controlled. It can be helpful to hold the hip to keep things steady and make sure you're not rolling back. You can hold your belly to give a little reminder to turn that core on as you lift. A couple more. All right. Shake it out, wiggle it out. Let's switch sides. Stay nice and even. And on my side, knees bent, feet together. Bend my hip, and then get my breathing. Inhale, exhale, lift the leg, pull the belly in. Inhale to lower, exhale to lift. Fine to make adjustments along the way. You realize you're starting to lose the form, just take a second, reset, get comfortable, and start again. The more forward you are, the more that leg has to lift up against gravity, so the more you should feel it in that hip muscle. You might even feel it on the bottom leg, because as this leg lifts, this leg is pushing down and grounding to give you support. So it's normal to feel these exercises, even though if we're targeting one area, you might feel it in another location. Just check in with yourself and take your time, give yourself rest breaks when you need to. We just always want to keep breathing. We don't want too much pressure on our pelvic floor. It's been through a lot, our core. We're just trying to give it the support it needs to come back to where it was before, or even better. Good. All right, so we should feel that in our hips. We got our hips working, gotten our core engaged. And as we keep moving, we're gonna move into more functional strength. So having strength is one thing, but we need it to apply to our everyday life. So what we're gonna do is work on a sit to stand or a squat, depending on what your comfortable challenge is. So it could be your couch, chair, maybe not a rolling chair, but a chair. And you're going to inhale to sit, exhale to stand. So we're incorporating the breath, our core engagement, and strengthening our bodies in terms of function. So we're gonna inhale, right on the edge of the seat, exhale, stand up. For more of a challenge, you can inhale to lower, exhale to stand up, and not go all the way into the seat. Either a tap or a hover, or just a moderate depth squat. It could be a mini squat. Spine, where you feel the work in your legs, but we're not feeling any downward pressure on the pelvic floor. We're feeling supported in our core. We're lifting up and giving ourselves this support from within. Nobody's perfect. We all mess up. We all get tired. Some days might be easy, other days might be more of a challenge, but just do what you can. Good. Couple more. Good work. All right, we did our functional strengthening. Now we're going to move on to a little bit of a cool down and some balance. So what I want to work on, you can hold your palms, grab your hips, whatever gives you a little more support. You could hold on to a table or something nearby for support. But I'm going to start to slow our breathing down. In through the nose, out through the mouth. Feel that breathing starting to come down. We're going to alternate marching. So we're going to get a little lower ab work, a little bit of balance. Slow and controlled is the way to go. We don't want much of leaning or tilting to the side. So when we exert, we exhale. So as we lift, we exhale. really like to do for my pelvic rest is I like to lay with my feet up on a chair, ottoman, a couch, whatever surface, so that way I'm giving my pelvis, my lower abs a break, saying good job, that's enough, you did great, letting everything cool back down, taking a nice deep breath in, sighing off any tension or stress, knowing that you did this thing for yourself and you are getting stronger each and every day. Even if it doesn't feel like it, every bit you do helps you restore that strength. Great work, everyone. Thank you for joining me on this first video. I hope it helps you, and I look forward to seeing you guys on the next one. Bye.